Alrighty, so this is group 5, and we are presenting on case 3, false identification. So pharmacy team is going to go ahead and answer that first question.
Yes, so the scope of practice for pharmacists in this case is that our role here is to check the correct patient identity using date of birth and name to review the medication and review the medication history of the actual patient and not Maria. Therefore, it is important for the pharmacist to ask and clarify any past medications or any allergies.
Alrighty, and as far as the scope of practice for the nurse in this case, it is not the nurse's responsibility to report this patient to authorities for being undocumented or for her using Maria's identity. However, to care for the patient with Maria's past medical history instead of her own is definitely a violation of the nursing code of ethics.
The role of the physician in this case is to confirm the patient's past medical history as well as chart review previous medications and interactions with certain medications. Before giving the ROGAM and pain medication, the physician should have confirmed the identity of the patient. If the identity is determined to be false, the physician should not continue treating the patient under this false identity, as this can result in poor care for the patient.
All right, so the role that interprofessional team have in engaging Maria would be the interprofessional team should make Maria more engaging and revealing in order to make the diagnosis and evaluation process more transparent without any underlying confusion of medical histories from the past. Also, the interprofessional team should make sure that the patient is isolated to prevent the spread of COVID-19 and should convince her in many different ways, such as this could lead to long-term absence from your work, this could affect other workers and could possibly lose job in a worst case scenario. And because she is hiding a lot of the information from the healthcare team, it is hard for nurses, pharmacists, and physicians to communicate with correct information of Maria, as the record is actually for two different people. And they need to clarify the patient's identity and make a note and actively communicate to decrease this confusion.
So the responsibility of healthcare providers when they learn of insurance fraud is to report it. While we do want the best for our patients and we do want them to get the treatment that they need, insurance fraud is illegal, and because of this, providers should report insurance fraud to the Texas Human Health Services.
The legal implications of the ROGAM and narcotic prescription in this case can be pretty serious because it can be considered insurance fraud. The implications could be even worse with the narcotics prescription because it is considered like a controlled substance. So the penalties could be harsher.
Knowing this information does change our treatment plan and recommendations, since different medications have different potencies and different side effects, which can impact things like drug abuse and make the legal implications different depending on the specific medication. So a provider not only needs to make sure that the correct medication is going to the correct patient, but they should also be aware of the safety profile of the medication before giving it out.
Alrighty, there are many public health implications involved in this case as well. For example, if the patient continues to go to work and just disregards their positive COVID test, she risks transmitting COVID to her to her employer and her coworkers. The patient could also further contribute to the ongoing spread of COVID-19 and possibly cause an even larger outbreak within her own community on a much larger scale. Not only could the patient cause others to be sick, but if she spreads this to someone with a compromised immune system or to an elderly person, the infection could even result in death for those individuals. So that is the end of our discussion for case 3. Thank you very much.